I'm Sean Moffat. I'm a GP based in Ballina, North Mayo. I'm currently team doctor with the Mayo senior team and medical director with Mayo GA. It's my 10th season with the senior setup in Mayo GA, having served a kind of an apprenticeship with minors and under 21 for the previous 5 years. So my role encompasses general player welfare. It's a season round role, so we'll be looking after the training, condition, general health of the players. Well, I suppose my interest in concussion goes back as far as 2007 when I was on the medical committee here. My brief was our first position stand in concussion. And we were actually the first sporting body in the country to come out with a position stand on concussion. And from there, I suppose, the opportunity came up to be involved with UPMC in their model of care, which is slightly different from the European model of care. It's more targeted evaluation and active management of the injury. We have weekly multidisciplinary discussions. So there's standardisation of care, there's group learning, there's objective markers of a patient's initial presentation, their recovery and their exit from the concussion model. So rather than being a sole practitioner, I think there's benefits in being involved in a standardised, quality assured network. And UPMC certainly has been one of the leaders in concussion care in the States for the last 10-15 years, so it's nice to be able to tap into the best aspects of their care and bring it to our unique patient population here in Ireland. I suppose definitely in the last decade our awareness about concussion has gone up hugely. I think GA have been to the fore with that, and I think the UPMC model in the last year or two gives us a very objective marker in assessing patients to see where they are at symptom-wise. It's a treatable model of care, which is a difference from the old way where we just watched and wait to see the patient's symptoms resolve. In my experience, patients or players coming in with concussion are quite anxious about the injury. It's not like you're coming in with a knee or a shoulder injury where you understand the mechanism and what's going on. It can often be they're anxious, they're concerned about getting back to play, getting back to school, even work. If it's a younger patient, their parents are anxious because they can see a difference. So the model of care, and I'd often get parents to sit in, they can see the history taken, they can see our clinical examination, they can see the symptoms stirred up, they can see the impact report. And for the vast majority of them, when we're seeing them on their second or third visit, they can see improvements. So the feedback has been very good. And even as a doctor, it's very satisfying to have objective markers that players are improving. Because the key thing with concussions, you want to make sure that they're symptom-free before they go back to contract sport or before they go back to full schooling or work.